At Marina Hills Animal Hospital, we recommend that pets have their teeth cleaned under anesthesia on a routine basis, typically once a year. Some pets do well and don't need their teeth cleaned that often, but the best way to know is to have a thorough physical exam with a doctor. When we do clean pets' teeth, here's the process that we go through. First, after a careful examination, the doctor will determine the relative risk versus the benefit of the procedure. Because we're using anesthesia, it's important that we evaluate our pet's cardiovascular status, as well as determine how their major organs are working, specifically by running blood work, as we plan the anesthetic episode. The dentistry itself, the routine is that we find a day that fits your schedule and ours. Pets eat dinner the night before the procedure, but no breakfast on the morning of. When they arrive at the hospital, they are examined again by the doctor on the day of the procedure to ensure that nothing's changed since their previous exam. We routinely place IV catheters. This allows venous access for the administration of drugs for the procedure, and if necessary, the use of emergency drugs should there be a problem during anesthesia. Pets are routinely maintained on IV fluids before, during, and after their anesthetic event, regardless of the purpose, in this case for dental cleaning. The dental cleaning starts with a careful examination and charting of the condition of the mouth. Specifically, we evaluate each tooth and determine the health of the gums around each tooth by probing and charting. We then take dental x-rays, very similar to what may happen at your dentist office. We use an electronic capture, so it's a digital dental x-ray to take a look at the periodontal structures of all the teeth. And then based on what we find, we determine which teeth will be cleaned and which, if any, teeth need to be removed. And sometimes there's the option of advanced dental care at the specialty referral hospital. If the situation requires it, we always make that available to our clients as well, specifically a root canal. Most often our clients, if the tooth is in great distress, elect to have that tooth removed, which is an extraction that we can and do perform here at our office routinely. We clean the teeth using an ultrasonic scaler. We polish the teeth. We apply fluoride, which hardens the enamel, and then we routinely apply a dental sealant. The dental sealant feels like a wax that repels plaque and tartar. If applied on a weekly basis, it extends the time between dental cleanings by about 40%. That's something that our clients do at home to care for their pets' teeth. When teeth have significant gingival inflammation, we treat that with our laser. The cold laser reduces inflammation and blocks pain. On the occasion that a pet does need a dental extraction, we routinely use local anesthesia to block the nerves to that area. This allows us to minimize the use of general anesthesia, which is safest, of course. Teeth are removed. Sometimes oral surgery is required to make sure we're getting the roots and have access to the parts of the tooth that we need. On the occasion that we do dental surgery, then the gums are sutured back where they came from using an absorbable suture. That suture holds its strength for a week while the mouth heals, and then that suture dissolves, which is nice because that means we don't have to go back in there and remove the sutures. After pets go home from their dental care, our routine instruction is that they be home an hour before we give any food or water. After an hour, we offer water. Some pets are nauseous after anesthesia or the car ride. We want to make sure their stomach is settled. Once they're able to keep water down, we offer food that same evening, typically half of their normal volume of food, and then we're back to the normal ration the next day. If pets had dental extractions with their dental procedure, then we'd recommend that food be softened. So dry food gets moistened with water, or we can switch to a canned food until their mouth feels better. Post-operatively, depending on what we found in the mouth, we may give antibiotics post-operatively and pain medication so our pets are pain-free after their procedure. If you have any questions about your pet's mouth, see your local veterinarian. If you're here in Laguna Niguel, we'd be glad to care for your pets here at Marina Hills Animal Hospital.